So we're going to look at the conjunctive type therapies, those synergistic therapies, the combination therapies that were mentioned there in the anti-cancer activity of cannabinoids. So here we're looking at a publication, Molecular Cancer Therapeutics, and I have two articles right here. This first one is addressing cannabinoids along with temozolomide, or TMZ, which is what I showed you in the diagram in one of the videos prior. That TMZ is what's used in gliomas and brain cancers because it passes the blood-brain barrier. They don't use IV chemo for brain cancers. So this is the TMZ. This is standard. This is like, I guess, what you would call the gold standard, so to speak, I guess, if you could call it such. This one is how cannabinoids interact, or it's cannabidiol and THC enhances the anti-cancer effects of radiation in glioma models. So I'm just going to take a quote from each one. Combined treatment with TMZ, temozolomide, and cannabinoids overcomes the resistance of glioma xenografts to TMZ antitumoral action. Resistance to TMZ antitumoral action frequently contributes to the poor life prognosis of patients with GBM. So you got a poor prognosis with GBM anyway. And then a resistance to TMZ, the antitumoral action of TMZ, the chemotherapy, makes it even more of a poor prognosis. And so what they're saying is that cannabinoids can overcome the resistance that the gliomas present towards the TMZ. So yeah, basically, if there's a lack of efficacy with the TMZ, cannabinoids could be added in order to boost the efficacy of it, or the effectiveness of TMZ. Here's the interesting one. This is on radiation, of course. So the idea is that if we can do these things in conjunction with each other, then you don't have to give any one specific one in too high of a dose. So you can lower the amount of chemotherapeutic dose and yet increase its efficacy by adding cannabinoids. Same thing with radiation. You don't have to give as much radiation if the amount of radiation you're giving with cannabinoids is boosted by the cannabinoids. So cannabinoids have been shown to specifically inhibit glioma cell or glioma growth, as well as neutralize oncogenic processes such as angiogenesis. So they're right here just showing that cannabinoids have shown to specifically inhibit growth, and the processes that are going along with the cancer oncogenic, the process of cancer growing, such as angiogenesis, that's formation of blood vessels, so the tumor can feed. Cannabinoids can prime glioma cells to respond better to ionizing radiation, and suggest a potential clinical benefit for glioma patients using these two treatment modalities. I had both of these. TMZ was alright. It was like any other chemotherapy, all the kind of sickness, same stuff. The radiation, though, with me, because the tumor was so large and it was already all around the brain in a couple of different spots, my radiation oncologist blasted it. And he told me he was going to do that. He said, I'm going to give you everything that I can so we can just hit this once, because I'm not going to be able to do it again. And the reason he couldn't do it again is because with too much radiation, you start getting, what is it called? Neurodegeneration. So like your neurons start degenerating because of the damage done by the radiation contact. So, in other words, both of these. So you got radiation to my brain, freaking took out my hair. So I have like patches of hair. I'm 14 years out and I still have patches of hair on my head. And you can see it's because of the beams. It follows the beams that where he pointed it to go. I mean, I'm glad I had it. And patches of hair is better than being dead. But the fact that this could have been used, cannabinoids-based treatment with the radiation, so he used less radiation, would have been awesome. And so that's why I'm giving you all this information, because I want y'all to know that cannabinoids can be used in conjunction with both chemotherapy and radiation, and if anything, it helps both of those while protecting the cells that are also getting damaged by the chemotherapy and radiation. Boom. Got that one done. Talk soon. Love y'all.